Hello, everyone. My name is Joseph Ballard, and I'm presenting on neurocognitive disorder due to traumatic brain injury. Traumatic brain injuries, or TBIs, are anything that can cause damage to the structures of the brain. They can be caused from impacts or rapid change of direction, or anything that causes the displacement of the brain inside the skull. They're typically categorized as mild, moderate, and severe, and they're rated using uh, the Glasgow Coma Scale, loss of consciousness, and amnesia as the criteria. Um, so the Glasgow Coma Scale is looking at eye movement and verbal response and motor response. It's specifically how spontaneous it is and if they are able to respond to verbal cues or physical cues. Then loss of consciousness is looking at the duration of that loss of consciousness. Were you unconscious for 5 minutes or 30 minutes? And then amnesia is looking at, do you have amnesia before the event or after the event? And then how long does that amnesia last? Does it slowly start to go away, or is it maintained for a long period of time? The diagnostic criteria for this disorder is a little bit different because the traumatic brain injury would be diagnosed and evaluated by a separate medical professional, and the neurocognitive disorder is what is actually being rated in the DSM. They're two separate things. So, this disorder, it must meet the criteria for a mild or major neurocognitive disorder, which we will go over later. There also must be presence of a TBI, so shown by some injury to the head that caused loss of consciousness or amnesia, or low scores on the Glasgow Coma Scale, confusion, disorientation, or any other neurological symptoms. And then um, the neurocognitive disorder must begin directly after the TBI, so there has to be a direct correlation between the two. The history of traumatic brain injuries, they've long been considered as life-threatening conditions. Brain surgery was always been considered one of the most difficult and frightening things to have to do. In the Italian Renaissance, they theorized that loss of consciousness was caused by the brain shaking inside of the skull. And so that is where the name concussion came from. It means to shake in Latin. As far as a little bit more modern research, eventually they found that loss of consciousness was caused by neuron damage in the brainstem, and that long-standing concussion symptoms were caused by microscopic brain damage, which typically includes tearing of axons, well, but it can also include other things, disruption of neurotransmitters and things like that. And a lot of recent research is focused on sport and military concussion because those are the two of the biggest populations in TBIs. Um, so that's where a lot of modern research is being focused. The DSM for this section, some of the nomenclature was changed a little bit from the DSM-4 to the DSM-5. So dementia was what the section was called previously, but that was changed to major neurocognitive disorder. And then there was a not otherwise specified distinction that was removed, partially to decrease confusion and of things just being thrown into the not specified category. And that is now being replaced with mild neurocognitive disorder. Um, So, neurocognitive disorder, the two different types, mild and major. Major is obvious neurocognitive decline. It causes concern for the individual and it decreases their performance to some level. They have some cognitive deficits that are interfering with their ability to be independent, and it cannot be exclusively delirium. The delirium can be a part of it, but it can't only be delirium. And it also cannot be better explained by some other disorders, such as depression, that could be causing these neurocognitive decline also. And then mild neurocognitive disorder is very similar. There's less neurocognitive decline, but still enough that it's causing the individual concern or it is decreasing their performance. But one of the major differences, which is why it's highlighted in the PowerPoint, is they're still able to be independent. but it still cannot be delirium and it cannot be another disorder. Some of the symptoms that go along with traumatic brain injuries often are like personality or emotional changes, such as easily frustrated, becoming anxious or irritable. Also, there's a lot of physical issues that come along with it, such as headaches, nausea, sensitivity to light, balance disturbances, vision disturbances, sleep cycle disturbance. Um, so those are all things that can come along with a traumatic brain injury. The prevalence of TBIs, about 1.7 million reported annually, um, and about 2% of the population is living with some sort of disability due to a TBI. Males are at higher risk than females for having a TBI at some or a concussion at some point in their lifetime, specifically. Um, yeah, some studies showing they're even twice as likely. And according to the CDC, the ages 0 to 4 and over 75 are the age groups that are most likely to come into the ED with a TBI because they are at the highest risk for a lot of different issues that can develop because of a TBI. There was actually a 54% increase in ED visits due to TBIs from the years 2006 to 2014, which is a huge jump. Um, and concussion rates in youth sports across the board increased about 15.5% per year between the years of, I believe, 96 and 2006, or 2007, 11 years. Um, but that's partially because we've learned so much about concussions, even in the last just couple years, but especially in the last 20 years. So there's much better diagnosis and referral than there was previously, but also it is very likely that the rates are consistently increasing. One thing that can be caused by repetitive TBIs is chronic traumatic encephalopathy, or CTE. It is caused by repetitive subconcussive blows, or sometimes with concussions or other TBIs thrown in the mix. It causes a buildup of the tau protein on brain structures, so it decreases your executive function, decision making stuff, memory, and impulse control. And so some symptoms can also include apathy, depression. It's linked closely with suicide and dementia, especially early onset dementia. And right now, it can only be diagnosed post mortem, which is scary. And not a lot is known about it, which is part of the reason it's such a frightening disease. It's a big unknown and it's hard to diagnose, which makes it really difficult to treat because if you can't diagnose it while they're still alive, then how can you treat it? Um, Post concussion syndrome is another issue that comes along with repetitive, sometimes repetitive TBIs. The more TBIs someone has, the more likely they are to experience this. There are little to no cognitive impairments, but lingering symptoms which interrupt their normal life. So I've almost left this out because it doesn't really fall into the neurocognitive disorder um, realm because there's not cognitive decline. But one of the primary treatments that is being researched right now is cognitive behavioral therapy, interestingly enough. So I thought it was fitting. Um, they often experience just residual symptoms of specifically headaches and visual eye stuff that can persist from months to years. And a lot of researchers have compared it to some other complex symptom syndromes, such as like chronic fatigue syndromes. So it's more that you are experiencing these symptoms, and a lot of researchers believe that it's somehow emotionally or anxiety related. So these symptoms persist long term without any real physical underlying cause as far as the researchers can tell. Some ethical considerations to consider. Goodness. Young athletes, they can't really make the decision for themselves of being put in danger of TBIs with contact sports. So that's kind of a fine line of yes, their parents can make the decision for them, but if the parents aren't well educated, then is anyone really making an educated decision on that? And then individuals with post-concussion syndrome, they may experience symptoms with no proof. So how do you support them well, while also being careful of looking for malingering, or people who are trying to use it to gain attention or something like that. So those are just two things that I thought of. And for my discussion question, do you think that our society needs to change its stance on contact athletics, especially for children, to protect them from TBIs and their issues that are related to them, especially in the light of newer long-term issues such as CTE? And here are my references at the bottom. And thank you very much.